The time has finally come. For those of us who are seeking office to be in this United States Senate in 2010, one of the primary issues that we were engaged with and heard from tens of thousands, if not hundreds of thousands of our citizens, was the concern over the passage of the Affordable Care Act, now called Obamacare, and now also called the Unaffordable Care Act. That was the bill that was jammed through the Senate on Christmas Eve without one Republican vote. Republicans were denied that vote because the Democrat Party controlled both the executive branch and the legislative branch with numbers that put them in a position where they could jam anything through that they wanted without any offsets, without any amendments, without any changes, without any improvements, without any input from the other party. I think we've learned through history that when one party has total control and passes legislation, it doesn't represent what the American people want. They want debate. They want adjustments. They want the other side of the story to be told. And then they want their representatives to be able to come to some kind of consensus in terms of how we would deal with, yes, an important issue called health care for American people. Were there needed improvements at that time with our health care system that had to be addressed? Yes, there were. Was there consensus almost on both sides of the aisle, Republicans and Democrats, that changes could be made? But the way the American people wanted that done was for us to represent their views, to look at all the options, to have some balance, and that's generally how major programs that need to be addressed successfully can be addressed successfully. Welfare reform is an example under President Clinton, a bipartisan effort, with both sides recognizing that changes needed to be made to a system that was not working as well as it could. By working together in a bipartisan way, we ended up with a very effective, efficient, new system compared to the old system. That was not the case with Obamacare. So throughout the 2010 period of time when I was campaigning for office, I heard the stories from Hoosiers all across the state, big cities, small cities, rural, coffee shops, factories, employers, employees. I heard from all of them about their concerns about how this would play out. You know, we were promised by the president that we didn't have to worry about losing our health insurance, that if we liked our current plan, we could hang on to it. That turned out to be totally false. We were also promised by the president that not one penny, this would not cost one penny to the American taxpayer. Now we have the contrast to what this program has cost and will cost over a 10-year period of time, and it comes close to $1 trillion. So one penny, 1 trillion, pretty good gap between that. American people, and that is through the taxes that were inserted into the Affordable Care Act, the Obamacare Act, that were supposed to cover the cost by taxing the American people of up to $1 trillion over a 10-year period of time. We were told by the president that if we liked our current plan, premiums would not go up, premiums would not increase at all, period. Trust me, take it to the bank. Obviously, that has not been true. We have now seen the rolling out of this done in a way that only the federal government could screw it up. Only the federal government could fail after spending an extraordinary amount of money, well over $500 billion to roll this thing out in a totally dysfunctional way. And today we continue to hear from our constituents about failed promises, about higher premiums, extraordinarily higher co-payments, have not been able to keep the doctor that they had. They're paying taxes to cover something that simply has not worked. It has been a tortuous process to get to the point where we have the opportunity, not being blocked by the other side, we have the opportunity now, which will occur tomorrow, to finally get an up or down vote on a reconciliation bill that essentially is designed to repeal Obamacare. There have been many alternatives out there that have been tried, tested, and true in terms of how we can deal with our health care system. We're not just simply walking away, leaving people in the lurch. We're simply saying this whole thing needs to be repealed so we can build a much better way of providing health care for our citizens. And this is the opportunity. Now, there'll be all kinds of amendments here. There'll be gotcha amendments. I dare you to vote for that. They will be irrelevant to the final issue of what we are doing and what we're voting on. It'll be clear to the American people. This is a vote strictly on the repeal of Obamacare. You're for it or you're against it. Come down here and defend it if you like it. If it's worked in your state, I haven't heard anybody really coming down and singing its praises. But if that's the case, come down to the floor. This is the time to do it. Just say, this is why we need it, this is why it's good, and refute perhaps what we say here, but I think it's pretty hard. I don't think I've heard anybody come down and defend the statement that if you like your health care plan, you can keep it, that it won't cost you a penny, that your premiums won't rise. We just simply know that that is not the case. And so this is the moment. We will be able to make our yea be yea and our nay be nay, and the American people will know exactly where we stand. And I believe we will have the votes to pass this in the United States Senate, as we will have the votes to pass it in the House of Representatives. It will then go to the president, and the president then will know where the Congress stands, and they'll know where the American people stand if he doesn't already. I'd like to mention just one aspect of it that has a pretty astounding impact, negative impact on my state, and that was the imposition of a gross sales tax on the sale of medical devices. My state is one of the leading states in the nation of medical device manufacturers, but this tax levied on their gross sales, not on their profits. And in that sense, those small companies trying to develop something that will improve people's lives or save people's lives through medical device research and development, and then ultimately marketing, have struggled because through the development process, they have to pay a 2.3% tax on everything they sell, even if they're not yet making a profit. It has been devastating in terms of employment, in terms of research and development on this cutting edge business and manufacturing that is saving lives, improving the life of people. And so critical, I think, to this vote is the medical device tax, which is denying people the opportunity to produce medical devices that save people's lives and enhance their lives. We have more than 300 FDA-registered medical device manufacturers in Indiana. It is boosting our state's economy and producing technologies that are changing and saving lives. But since the implementation, these companies have had to lay off workers and shelve plans to expand and build new facilities. One major manufacturer had lined up 5 new plants in Indiana for a significant increase in employment, a significant increase in research and development, and production of medical devices, simply to cover the cost that they now had to pay on the tax for their previous sales on other products. It is an egregious tax that has affected many of my companies in the state of Indiana. In conclusion, Mr. President, how ironic it is that Obamacare, which President Obama said would increase health care coverage, is actually a barrier to improving lives and health outcomes. And so it's long past time for Washington to stop punishing the medical device industry and innovators in Indiana and across this country. I want to conclude by saying Obamacare, a poorly written and poorly executed health care plan, is not working for the overwhelming majority of Hoosiers in my state and the majority of Americans. Remember when the then Speaker of the House said, well, we really don't know what's in this plan that we've just passed. We'll have to implement it before we know what's in it. We now know what's in it. We now know what the impact has been. I've been on this floor for hours over the past 5 years talking about real-life examples of impact of this unaffordable health care act on Hoosiers. I have given personal testimonies that have been given to me by people. I have heard the horror stories of people losing their insurance, of their premiums skyrocketing, of their co-payments putting them in a position not to be able to, making them not able to afford health care, and just praying every day that someone in the family won't get sick because they can't even afford the copay before they get to the coverage. This poorly written and poorly executed health care law is not working, and the law's continued unpopularity is a testament that to what it has meant for most American families: rising premiums, higher costs, decreased choices, a poor health care process, and all the innovation and things that we could have done had we worked through a normal process on this are sitting on the shelf. Mr. President, the time is now. It's an opportunity that we've been waiting for now for going on 6 years. And so when we have that vote tomorrow, despite all the chatter, despite all the attempts to define it as something other than it is, the real vote comes down to whether or not you want to continue government-run health care or you want to look for a better model. Mr. President, with that, I yield the floor.